Good afternoon, everyone, and thank you for joining us today at our media advisory. Hopefully you're all staying reasonably cool out there. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Jason Thorne as our new Director of the city's Emergency Operations Center. Jason, it's great to have you joining us today with our media briefing. And of course, we also welcome Danko, the Chair of the Hamilton-Wentworth District School Board, and Patrick Daly, Chair of the Hamilton-Wentworth Catholic School Board. We anticipate that we'll hear some interesting news about back to school coming up in September. If you haven't already done so, please get out and get your vaccine. There are lots of options now for getting vaccinated, including walk-in clinics this week at Tim Hortons Field, August 23rd, 24th, 25th, where you can get your vaccine or first or second dose and stay and watch a Tiger Cat practice and be entered into a draw for some great prizes. So if you can, make your way down there, and lots of information available about where you can get a vaccine right now, walk-in options, booking appointment opportunities, mobile clinics. Go to hamilton.ca/get-your-vaccine for all of that information. The public health guidance demonstrates that vaccines provide a high level of protection against COVID-19 and its variants, and they do reduce the risk of severe illness and hospitalization. So to date, 78.9% of our population in Hamilton has received at least one dose of their vaccine, and almost 72% are fully vaccinated. So we're moving in the right direction, but we need more of you to do the same. In order to do our part to expand the number of people vaccinated in our community, Hamilton City Council will be reviewing a policy later this week that would require all city staff to verify their vaccination status. As a major employer in the city, we have an obligation to undertake all necessary precautions to protect our workforce, their families, and our community as a whole. And as we all know, achieving high levels of vaccination against COVID-19 is the best way to ensure the community can have the highest levels of protection heading into the fall. And if you haven't done so already, I encourage you to go out and get your vaccine in all of those potential locations where you can get them now. I'm going to pass it over to our Director of City Emergency Operations Center, Jason Thorne, for some information around what's happening in our city in terms of the impacts of COVID-19. Jason?
Thank you very much, Mr. Mayor, for that introduction. And yes, I'm happy to be joining these media briefings as I take over starting this week in the role of Director of the city's Emergency Operations Center, taking over from Paul Johnson, who's been in the director role for the past year and a half and has gone on to a new role at the City of Toronto. So of course, we thank Paul for all the work that he did for the EOC over the past year and a half. And I also want to welcome the chairs of our two school boards for joining us here today. It is great to have them as part of this briefing. I know there's a lot of people in the community who are getting ready for the return to school, either for themselves or for their children. And that, of course, raises a number of questions and considerations. And so it'll be good to explore those here today with the two school board chairs. I have just a couple of very brief updates from the city's Emergency Operations Center today. First, and as was reported previously, last week the province announced that they would be pausing Ontario's exit from the roadmap to reopen. So what this means is that we'll be remaining in step 3 of the province's reopening framework for the time being. As a reminder, under step 3, there are a number of things that we can do in the community. Most businesses are open. However, we still do have some restrictions to be aware of. Outdoor social gatherings and organized public events can occur up to 100 people. Indoor social gatherings and organized public events can have up to 25 people. There are still some capacity limitations on retail settings depending on the nature of the business. Indoor sports and recreational fitness facilities are open with capacity limits, and personal care services are also now open, again with capacity limits to ensure physical distancing. And as everyone knows, as part of our exit from step 3, a lot of that is tied to vaccination rates across the province. And Dr. Richardson will talk in a moment about some of the efforts that the city is making to increase vaccination rates across the city. But I do want to echo as well what the mayor said about vaccinations for our staff here at the City of Hamilton. As you heard from the mayor, later this week, Hamilton City Council will be discussing whether to have a vaccination verification policy in place for city staff. As a major employer in the city, we do have an obligation to undertake all the necessary precautions to protect our workforce, their families, and the community as a whole. While we don't have the details of this policy just yet, they are still being finalized. We expect that it will be similar to what a number of others are starting to develop other major employers, other larger municipalities, our post-secondary institutions, not just in Hamilton, but across the province. We're looking to some of those as well for guidance and input as to how we structure a City of Hamilton policy. So we'll be looking forward to bringing that forward to Council this week, and we'll have more details at that time for media and the community as well. Finally, just a quick note with respect to enforcement. We've been seeing our local businesses really doing a great job following the public health guidelines that are in place, keeping our residents as safe as possible. We're seeing significantly fewer charges to businesses than we were just a few months back. Only one business charged this week in the city. That was for failure to post signage at the door about face coverings and for having some staff not masked. And as usual, the details of any charges under the various COVID orders are up on the city's website. So with that, I will turn things over to Dr. Richardson.
Thanks very much, Jason, and welcome to your first media briefing. It's great to have you taking on the role of the city's Emergency Operations Center Director. So great to have you with us. And a very warm welcome as well to Chair Danko and Chair Daly for joining us today as we talk about particularly around schools and going back to school in September. First, I'm going to talk a little bit though about cases and where we're at on that front. And unfortunately, as you've heard here in Hamilton and elsewhere in the province, our case numbers do continue to rise. We're at 22,565 cases in total in Hamilton as of today, a net change of 177 since Friday, August the 20th. And with these levels of activity, this mirrors about this November of 2020 in terms of a comparison around the activity levels that we're seeing. We are seeing increased rates amongst those all the way up to 60 years of age, but particularly cases are rising sharply in those 18 to 39 years of age. Our 7-day moving average is now sitting at 57 cases, and the weekly incidence is sitting at 66 per 100,000 population today, and our weekly reproductive number is at 1.22. You know, the thing that we're all trying to prevent most of all is hospitalizations and deaths, and our average number of new hospitalizations is also going up. There are currently just over 4 new hospital admissions each day on average. Fortunately, the number of deaths is remaining low. We do have 9 active outbreaks going on at the moment, with 2 new outbreaks having been reported today. And as reflected in all of these numbers, our percent positivity is also going up. We're sitting at 5.7%, sitting in just the second place in the province, with Windsor having now just surpassed our positivity rate. The good news is on the vaccine front, our progress does continue forward, and the Hamilton Healthcare Partners have administered 769,836 doses of vaccines locally. An estimated 78.6% of Hamiltonians 12 years of age and over have received 1 dose at least to date, and 71% are fully vaccinated of those 12 and over. So while we have a very significant portion of our population vaccinated, there are still many community members who have yet to receive a first dose or be fully vaccinated. And the vaccination coverage that we have is not equally distributed across our community. We do know, as you've heard from the mayor already today, that the vaccine does continue to give us a high level of protection against COVID-19 and its variants, and most importantly, reduces the risk of severe illness and hospitalization. As of August the 7th, of the 17,479 cases of COVID-19 that have been reported in Hamilton since December of last year, about 95% of those cases have been amongst those that are not vaccinated. And of course, as we talked about, being vaccinated does reduce your risk of hospitalization and death, and not being vaccinated, unfortunately, leaves you at risk of those 2 significant consequences from the Delta variant in particular. Our vaccine supply is abundant. We have plenty of it in the fridge, lots of it out in all sorts of different locations throughout the city. And community members can walk in to get their first or second dose. If they choose, they can also book an appointment in many of our different locations. And both of the vaccines, both mRNA vaccines, Moderna and Pfizer, are available at the vast majority of our local clinic sites. We are continuing to set up mobile vaccination clinics in neighborhoods with low coverage rates. And as you heard from the mayor already today, this includes our partnership with the Hamilton Tiger Cats at Tim Hortons Field, where they are, we're doing vaccinations today, tomorrow, and on Wednesday. And those who do attend the pop-up clinic can stay on after getting their vaccine to watch the team practice. They can get a voucher to get 2 Forge FC tickets and can enter a draw for Ticats tickets. Now, with this, our school board partners here, it's really important to think about school being just 2 weeks away. And as we head into the fall and more time indoors, of course, the clock is ticking for our community members to get vaccinated, and particularly those that are between 12 and 18 years of age, to get that protection with their first dose and ultimately their second dose of COVID-19 vaccine. It's really important as we think about going back to school, going back to in-person learning is absolutely essential. We must balance the risks to the mental health of children and families that happen with remote learning. And in consideration of this, we do consider in-person learning and how critical it is for the mental and emotional well-being of our kids. There are going to continue to be risks associated with COVID-19 this fall. The increase in case numbers make us assured of that, but those are going to be managed in the schools through the partnership that goes on between public health services, the school boards, all of those working together to bring down risks in those settings. And really, we're managing those risks in all of the settings that we're in, whether it's at work or we're doing essential tasks outside like grocery shopping or visiting a clinic, or the non-essential things that we choose to do each day as we go about our days in our community. The public health measures, infection prevention and control measures, and COVID-19 vaccination are going to continue to be essential means of reducing the risks associated with COVID-19. We're going to continue to closely monitor the situation locally, look at our case rates, look at the epidemiology of the cases that are happening here in Hamilton. And as needed, we'll be working with the school boards to introduce any additional measures that are deemed to be necessary in order to manage the risks here in Hamilton. Since we've been doing at the beginning of the pandemic all the way through, we'll be doing that to make sure it's as healthy and safe an environment as possible and a safe return to school. We're going to be continuing to put on clinics and now hosting those with our Hamilton healthcare partners and the school boards, looking at bringing mobile clinics to area secondary schools. They're going to be available, those clinics, to students, to their families, to the staff within schools, and asking elementary school kids that belong to that school community to go on to the secondary schools for their vaccine. And a reminder as well that now anybody who is born in 2009 and earlier is eligible to receive a first or second dose of a COVID-19 vaccine through any of our clinic sites. We have 20 mobile clinics scheduled at local schools between this past weekend and September the 1st, and we'll continue on to provide clinics all the way through into the fall. You'll recall that St. Joseph's Hospital elected to keep their clinic open, seeing a bit of an uptick in vaccinations there, and so kept theirs open through till September the 3rd. And First Ontario will be closing on August the 29th. For anybody who has their first dose, remember, as soon as 28 days pass from that, you are eligible to come in and get that second dose. And we very much encourage people to come and do that as soon as possible when they're eligible for that second dose. So by continuing to follow these measures, getting vaccinated, maintaining public health measures as we go forward as they're needed, that's how we're going to keep ourselves and our students and our community safe. With that, I'm going to turn it over to you, Chair Danko.
Thank you and good afternoon, everyone. I want to start by thanking the City of Hamilton, Hamilton Public Health, and our coterminous board, the Catholic School Board, for the ongoing collaboration and partnership throughout the pandemic. We couldn't be where we are without you. Now, at HWDSB, we are so excited to welcome our students and staff back to school this fall. Many of our students and staff are coming back in person after months online and, of course, the summer break. And as we go back, our key priorities are a safe return to school, but also supporting student re-engagement and well-being. And as we prepare for that new school year, I'd like to remind families that the first day of school this year is Wednesday, September the 8th. And for our JK and special education families, please look for any outreach communication from your school, as there may be opportunities to do a school visit before the first day. Now, to help families be informed and prepare for this school year, I really encourage you to subscribe to our website. It's hwdsb.on.ca, and that's where you'll get regular COVID updates sent to you, and you can get board information. Before school starts, families will be required to complete the screening attestation form. So you might recall that from last year. This is where you have to confirm that you will screen your child for COVID-related symptoms every day and only send them to school if they pass the screening. For the Hamilton-Wentworth District School Board or the Public Board, this will be available on the parent portal starting next week. Now, we do know that leading up to the first day of school, many students may be experiencing heightened anxiety. And let's be honest, many parents and staff are probably experiencing the same. For our students, if they haven't been in person at school for 5 months, we know that this is going to be an uncertain transition for them. And we've heard from our mental health experts that what our students need right now are caring adults, and we have our teachers and educators preparing to support them. But getting back to a routine and spending time with their peers is also really going to help with those anxiety levels. We are really excited to have a full return to athletics and extracurriculars this fall, as we know how important these activities are for student engagement and their well-being. Our protocols are being finalized, and we do thank our dedicated staff and volunteers for their support with athletics and extracurriculars. To return to school in person safely, we will be following many of the safety measures from this past year, and there's some enhancements that you might like to be aware of. Now, masking at the public school board is mandatory for students in kindergarten to grade 12, with reasonable exceptions, just as it was for this past year. Masks are also mandatory for transportation, and of note, the transportation portal did open today. Cohorting is another important safety measure that we can take. For our elementary schools, this will be by class, and our board has committed $6 million in reserves to reduce class sizes at the elementary level. In secondary school, it will be a little different than last year. There will be 2 cohorts for each student, as students will take 2 classes in person at a given time, following the quadmestered model of delivery. We will continue to have enhanced cleaning and case management with contact tracing. We really appreciate the support and the direction of public health. We do expect to have some finalized updated protocols communicated to families and staff in the next week. We've done quite a bit of work on ventilation, and I know that people have heard a lot about that in the media. So in terms of ventilation work at our schools at HWDSB, these include inspections, filter changes, remediation to systems that need it, and upgrade projects. We are also ready to deploy 1,000 HEPA units to kindergarten classrooms, as well as classrooms without mechanical ventilation that brings air in from outside. We are also really pleased to have the new policy from the Ministry of Education requiring all staff to show proof of COVID vaccination or to have regular rapid testing. And this will apply to transportation, to volunteers, regular visitors, and to trustees. Additionally, in collaboration with public health, as we've heard, we've got our school-based vaccination clinics currently being offered at our secondary schools. So again, I'd like to reiterate that students, staff, families, students from the surrounding school area can attend those clinics as walk-ins, and you can find the dates on our website, but also on the city website. Finally, for families who may need to change their selection of in-person versus remote learning, a parent survey will be available from September 3rd to the 10th for the public board, and you can share your choice. Any changes will take effect around October 7th during a regular reorganization. So all of these measures will support our goal to build a wall of protection around those who cannot be vaccinated, and that includes our students who are under 12 years of age. It will support a safe return to school that will help our students' mental, physical, and social health and well-being. And as we've heard, our schools are a reflection of our community. Keeping cases low in Hamilton will be important to support keeping schools open and activities running for students. So thank you to everyone for doing your part to reduce the risk for our students and our vulnerable populations. We really look forward to welcoming you back this fall. Please remember to subscribe to our website for updates. And thank you again to all of our staff for their ongoing dedication and hard work to support a positive return to school. Now I am pleased to turn things over to Pat Daly, Chair of the Hamilton-Wentworth Catholic District School Board.
Thank you very much, Chair Danko. And it's my pleasure to be with all of you and to provide some information on behalf of the Hamilton-Wentworth Catholic District School Board. And at the outset, I would like to echo previous words of appreciation, first to Mayor Eisenberger and City Council and all the dedicated staff who have worked tirelessly over the last year and a half for the good of our city. And I really do want to applaud them for their leadership and their great work, and to welcome Jason into his new important position. I, of course, want to express deep gratitude to Dr. Richardson and all of the staff working in public health. The partnership with them and with our friends at the Hamilton-Wentworth District School Board has really been phenomenal, and I think has contributed immensely to the safety and well-being of the students and staff. So I do want to applaud them. And of course, I want to thank our parents and staff for their understanding. Clearly, the last number of months have been like no other, and their patience and resilience has really been inspiring. And finally, I want to thank the dedicated staff throughout our school system and school leaders, teachers, and support staff in every single position who have worked heroically for the good of our students and for the good of our community. I want to, obviously, the safety measures that Chair Danko spoke about are similar to what's happening in our board, so I'll try not to repeat them, only to say our board and our staff focus has been, first of all, on our priority of health and safety, and secondly, student re-engagement, faith formation, academic achievement, and particularly mental health and student well-being. And I want to echo Dr. Richardson's comments. Our board has from the outset and continues to believe that in-person learning is best for students, and that we really encourage parents to consider strongly returning their children to in-school learning. In terms of health and safety measures, we have really worked very, very hard through our staff to improve the ventilation in our schools. That's been a priority of our board for many years, but the additional provincial government funding has permitted us to really accelerate those plans. We have installed over 1,000 HEPA filters in many of our classrooms and schools throughout our system, including, as Chair Danko said, all of our kindergarten classes. We have improved and upgraded all of our filters to the highest standard, MERV 13. All of the cleaning procedures that took place last year will continue. An important new measure, which again, Chair Danko referred to, was the vaccination disclosure policy. I won't repeat what she said, only to add that parents can be assured that all of the staff, all of the bus drivers, all the volunteers, trustees, contractors, any regular visit to our schools will either have received their double vaccination or will be getting tested regularly. And we heard in a call with the minister and our colleagues earlier today that could be a minimum of twice a week. So clearly, I think we can all feel very good about that. I won't repeat her other comments with regard to cohorting and quadmesters. We, like the public board, are following the provincial guidance. In terms of well-being and faith formation, I really would encourage parents to really look at our website. There are numerous resources in terms of a child's mental health and well-being, including a number of other resources in terms of academic achievement, whether in numeracy, literacy, and many other programs. Our adult education and summer school staff had many programs over the summer to assist children, students in closing learning gaps and really moving ahead, whether in literacy, numeracy, and many other areas. I want to again close by really encouraging staff, parents, students to get vaccinated, both for the health and safety of students and staff, but indeed for the good of our broader community. And just to assure you that we, especially our staff, have worked very hard to make sure the upcoming school year is as welcoming and is as safe and as enjoyable as possible for our students. So thank you, and God bless. And I will turn it over back to Mayor Eisenberger.
Thank you very much, Patrick, and thanks to you and to Chair Danko for all of your information. And the collaboration between public health and the school boards has been ongoing, and that's to the credit of not only the public health officials, but all of your administrators and teachers and all the partners that are working hard to keep our school children and staff safe, but also our broader community. And that to your point, all of this effort is to protect the residents and to beat this virus. And so we have to remember that we're still in step 3 of the roadmap to reopen, and we expect to be here for a while still. And we are seeing an increase in case numbers locally and across the province. So it's important to remain committed to the public health measures, such as keeping your physical distance as much as you can, and continue wearing that mask. And, if not in all instances, in most. And the best way, as Chair Daly just pointed out again, is to get the vaccine, to complete the vaccine series as soon as you can. That's a great protection, not only for yourself, but for your family and for the community as a whole. So let's all keep working hard to make sure that vaccination process is truly available. And now, more available than ever before. So there was a time where the vaccine shortages were the issue. That isn't the issue anymore. There's plenty of supply and plenty of opportunity to get vaccinated, both through our mass vaccination sites, mobile clinics, and up and coming today, tomorrow, and Wednesday at the Tim Hortons Field, where you can get the vaccine and stick around and watch practice and get signed up for some door prizes as well. So thank you for all your great work in the school boards. I can only imagine how challenging it is. I have a couple of teachers in my family, and the work that they've been doing has been difficult and challenging, but I think the entire school board work has been absolutely terrific in terms of keeping people safe and keeping our kids safe. So thank you for all that great work. I'm going to turn it over now to Jasmine for some media questions. Jasmine?
Great, thank you, Mr. Mayor. We have 5 media joining us for the briefing today. So we'll start with 1 question and 1 follow-up for everyone. For today, if I can please ask our media partners to address your questions directly to any of our 5 spokespeople. So first question will be to Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Thanks very much for taking my question. So my first question is actually for both board chairs and Dr. Richardson. I'm hearing from many parents and caregivers and students, for that matter, who are really concerned about school amid increasing community case counts and a 4th wave. And I just wonder what each of you would say to families as we near the start of the school year about what is being done, what has been done to mitigate both virus transmission and the disruption to learning this school year.
We'll start with Chair Danko, if you'd like to go first.
Thank you, and thank you for the question, Kate. That is a common question that we're also hearing. I think if I can remind parents and families to look at what we've done this past year, and Dr. Richardson shared that our numbers are around what they were last November. I know that there are concerns around the transmissibility of the Delta variant, but I've shared a number of enhanced safety measures. And we've always talked about having multiple layers of protection to make our schools as safe as possible. I think one thing that can be reassuring to parents with younger students who are not yet eligible to be vaccinated is the plan to have staff disclosure of vaccinations, or they will have to engage in regular rapid testing. And I think that is a layer that will be very important to help avoid COVID cases coming into the schools. Ultimately, families do have to make their own decision about what's right for them and their family. And as the public board will allow families to potentially change their option if they selected in-person or remote learning. And I mentioned that was between September 3rd and 10th, and that change would take place in October. Otherwise, I would encourage families to, if they have questions, to ask those questions. Be reminded that we did get through much of last year with these layers of protection, that we have a number of things that public health is supporting us with in terms of case management. And we will continue to monitor the status in Hamilton and in our schools and be responsive to that. I think I'll leave in supports for learning loss to another question, since I've taken up plenty of time. Let's turn to Chair Daly for additional response.
Yes, thank you, Chair Danko. And Kate, I would just add clearly since last year through provincial government funding and similar to the public board, again, this year we've taken significant amounts of funding, over $2.5 million to lower class sizes. So all of the measures that were put in place last year will be repeated, and as well, significant improvements as compared to last year in terms of HVAC, the level of vaccination, which Dr. Richardson has, and obviously could speak to much better than me, but clearly those additional measures were not in place last year. And really the level of transmission in schools, I think most people would agree. I don't want to say wasn't significant, but in terms of community transmission, was not nearly as significant. So I believe that parents can really be assured that schools are safe and that every single thing possible is to ensure that their children will be safe throughout the school year.
Perhaps I'll just wrap up, the three of us. I think that you've heard very much the pieces that are in place now as we figure out how we're going to live with COVID-19 this coming fall. And just, as in any part of life, we're looking at how do we balance risks. No part of life is fully risk-free. And in the case of COVID-19, what we're trying to do is ensure that we have as safe an environment as possible for students, for teachers, for anybody who's part of the school community to be working and learning in. And at the same time, considering on the other side of these issues, the very important risks to mental health, social development, emotional well-being for students that are being considered. So you've heard a whole host of controls and means that are now in place that weren't there last fall, and we were able to get through most of last year or much of last year with in-person learning. We'll continue to have all of what we had then in place and these additional measures. And I think we'll do a very good job monitoring as we go forward, balancing, looking if there's anything else that we need to do, but trying to provide the very best that we can for our students for this fall.
Thank you, everyone. My follow-up question is for the board chairs, and I just wonder if you can let me know, have school boards seen an increased demand for remote learning over the last few weeks? And if so, what has that demand looked like?
Certainly, I can start. I would say the demand so far has been anecdotal. It's been emails to trustees asking, what are my opportunities? Do I have a choice? Can I change my decision? But I haven't seen a significant increase in requests, like formal requests to shift to online learning. So families will have that opportunity. We'll get a sense that first week of September, if there is going to be more demand at the public board at least. But right now, I think a lot of families are looking for more information and looking at press releases like this or press conferences like this, as well as the information and protocols that are being shared by boards. And I think that information will help them ultimately make the decision for their family.
And Kate, my response would be similar. The survey we did in late June, the numbers were dramatically lower, which we were very pleased with as compared to last year. Over the summer, I know there have been a few requests, but to my knowledge, not many. Will there be in the next week or so? Because of the information that you've heard earlier, we're not sure. But again, all of the requests will be considered, and we have received no information that it would be anywhere near last year.
Great, thank you both. We'll go next to Sean Cowan from CHCH. Sean, you can go ahead.
Thank you. This question is for Dr. Richardson, specifically a couple of the outbreaks, the Sizzle nightclub and the West Highlands summer camp. Do you know if those are driven by the Delta variant?
In terms of which variant we're experiencing at any given time, it takes us a couple of weeks to figure out which exactly it is based on the whole genome sequencing. So we don't have that data yet for these, but given that over 90% of our cases are due to the Delta variant, we would expect that that would be the case.
Thank you. And then follow up to that question, still with those two outbreaks, I guess even the West Highlands summer camp, the Sizzle nightclub, a little bit younger, perhaps people who are experiencing COVID-19. Do you know if they're sick? Are they in the hospital? Do you know their symptoms?
So the symptoms we would be seeing are very much what we see with any case of COVID-19. There wouldn't be anything really that's different on that front. In terms of hospitalizations and the like, we can get to see if we can provide you some follow-up data around those ones. I don't have the specifics for each of those outbreaks right in front of me.
Great, thank you, Dr. Richardson. We'll go next to Richard from the Hamilton News. Richard, you can go ahead.
Great, thank you. My question is to the two school board chairs as well as Dr. Richardson. In terms of requiring vaccinations of staff, how do you feel about that? I don't know that your board has taken any position on that, whether staff should have to, similar as to what the city of Hamilton is considering, have a proof of vaccination rather than, just testing as the other option.
Yeah, well, maybe if I can go first, Richard, clearly our board hasn't taken a formal position. We're meeting on August 31st, but I know our Provincial Trustee Association, which I'm sure our board would be the same, that we have fully supported any and all measures, decisions introduced by the provincial medical officer of health or local medical officers of health like Dr. Richardson. So clearly we would be in support of mandatory vaccination if that was the decision. And that not being the case, at least up until now, we are supportive of the disclosure policy that's been announced. It is an enormous amount of work for the Human Resources Department and others in school boards, but we think that it's another important step.
And to follow up, I would echo what Chair Daly's just mentioned. Our Board of Trustees is meeting tonight, and I expect that we will have some discussion around the current policy that's required by the ministry to disclose the vaccination status and get testing if you're not vaccinated. With respect to mandatory vaccinations, I believe we will be discussing, do we have the option to make it mandatory and follow the lead of other institutions, and including what the city is exploring right now. Certainly I support it. I believe our board would support it, but I wouldn't want to speak for all trustees without having that discussion. I will mention that our union partners at all levels have said that they support mandatory vaccinations for staff, because we need to remember that when people are vaccinated in schools, it creates a safe environment for students, but also for staff. And so I'm interested to see if there will be further direction from the ministry as we move forward.
And I'll just add here, in terms of looking at our vaccination rates, we've done very well. We're sitting up at 71% having 2 doses who are over the age of 12, but we have a number of people who aren't vaccinated yet. Our children who are under the age of 12, we have a number of people who find it very difficult to get vaccinated. And we know that we need to sit up at about 90% vaccination coverage in order to make a real difference when we're facing the Delta variant. And the Delta variant is, it's highly transmissible and causing severe disease. And so we definitely want to see those numbers go up. Mandatory vaccination policies, such as the one that you're seeing now that the Ministry of Education has put in place, and ones that other places like our universities, McMaster, others have put in place, are very much encouraged in order to get those vaccine coverage rates up and reduce the risk of severe illness and death. And so, not only in these cases in education, which are very important as kids get back to school, but in all organizations across the city, very much encouraging people to look at these kinds of policies and how they can support vaccination in our community.
Great, thank you. And Richard, if you'd like a follow-up, you can go ahead.
Stephen Lecce earlier today. Has this issue come up with him when school board chairs have had the virtual meetings with him, and what's his response been to that issue, to this issue of, mandatory vaccination?
If I can go first, Chair Danko, I think clearly the government's position, his position is what's been announced, Richard, in terms of the disclosure policy. Beyond that, I'm not aware of conversations happening between whether school boards or trustee associations with Minister Lecce. I know that, I won't speak for public boards, but I know they have indicated publicly their support, and as well OCSTA, the Catholic trustees, have indicated that we would support that if that was the recommendation of the Chief Medical Officer of Health.
And I can just confirm that in the virtual meeting today, the question was brought up, and currently the ministry will continue with the current direction with the policy for vaccine disclosure and rapid testing, mentioning that, again, these are some protective mechanisms, that testing at least is required. It sounds like twice a week would be the minimum to help avoid COVID coming to schools. But I believe that as the situation unfolds throughout this fall and winter, the ministry will monitor that.
Great, thank you. We'll go next to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you. I hope everyone had a good weekend, maybe a chance to catch your breath before things get real busy or even busier. My first question is for Dr. Richardson. You mentioned that we need to balance the mental health of students with potential risks of reopening. How much of a bump in cases are we expecting as a result of reopening schools to do in-person learning?
Thanks, Bobby, and I hope you had a good weekend as well. I don't know that I can give you a measure at the moment in terms of what we might expect as schools reopen. We do know from looking at what we experienced last year, it's not just the schools themselves in terms of venue, but when people are back to school, there's a lot of other things that happen as well. There's people going back and forth, running errands on the way to and from school. There are different things that happen. And so it is that overall mobility that we see in a community that goes up that is the challenge, as people are having more contacts with more people. And so we are expecting that whether it's from people going into school or it's people going about other things and coming into closer contact over the course of the fall, that we will start to see further rise that's related to that. But I can't give you any specific numbers on it.
Thank you. And my second question is also for you. What will it take? Have we discussed any certain limit or a certain threshold in which schools would not do in-person learning again, where we revert to remote learning?
Thanks, Bobby. I'm sure that's a question that everybody's thinking about as we go into this school year and what that might take. And really the approach that's being taken, at least from the public health side, is looking at, what is happening locally. And, there'll be all sorts of those factors that we've been talking about today taken into consideration, whether it's about vaccination rates that are there in the school, whether it's about ventilation issues that might have been identified but haven't, yet been able to be further addressed, whatever it may be. We'll look at everything that's specifics in terms of what's going on in a particular environment. We'll be monitoring that with the school board partners, and we'll be looking at what more may it take. Our absolute hope is that this doesn't ever have to happen again. Maybe it's a transient dismissal of a cohort, as we've done before, or a short-term closure of a particular school, but we're really hoping that anything more widespread isn't necessary. But again, that's why we need those vaccination numbers to go up, and as well to continue to use public health measures as we go into this fall.
Thank you.
We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the question. My first question is for Dr. Richardson. Dr. Richardson, Hamilton has one of the highest COVID rates in the province. We've had either the highest or the second highest every week for many weeks now. Do you have an idea of what is driving that and why Hamilton seems to be being hit so much harder by the fourth wave than other communities are yet?
Hi, Joanna. It's absolutely a concern for us as we go forward. And we know that really there's a couple of things that drive that, as we were just talking about schools. It's the amount of contact that we're having that is driving part of that. It is also our vaccination rates and the amount of public health measures that we're utilizing. It's pretty much those same factors that underline COVID-19 transmission, no matter what and no matter when. And so the more we can do to get those rates up, those vaccination rates up, and we're out there doing that with our community. We've got lots of partners who are coming on board, as like the TICATs, as you heard about today. The school boards are going to be, are already actually now in the business with us of running clinics And so we're going to continue to do that. But again, encouraging people to follow those public health measures. You've seen that we've pulled back to stay in step 3 rather than continue in the exit strategy. And so we'll be continuing to monitor that and look and see if there's anything else in particular that's needed as we go through this fall.
Thanks so much. My next question is also for you, Dr. Richardson. Hamilton is still seeing decreasing vaccination rates despite the last mile campaign. There was only 14 people who went to the public skate at First Ontario. You know, do you have an idea of why we seem to be continuing to drop when it comes to vaccination? And what does this mean? Like, does it mean we need to change course? Is it those 18 to 39-year-olds, and why are they so tough? Like, what is sort of driving this, and what needs to be done to finally kind of get at it?
Well, I think, Joanna, we're doing what needs to be done to finally get at it. We've got all sorts of different vaccination options that are available in our community. We have some teams that are focusing on those census tract areas that have the lowest coverage rates and working with them. We have vaccine ambassadors who are out talking with people, helping to get them vaccinated. We have all kinds of partners on board that are helping, reaching out to the communities where they are trusted and have worked with these communities for long periods of time, which is an essential part of this as well. We have a number of partners like the school boards. We have some businesses as well, as you've seen, that have come on board. And so it's going to continue to be this way for the next many months as we go forward to bring those vaccination rates up as much as we possibly can altogether. We know that essentially there are some people that aren't interested in being vaccinated, just as is the case with usual vaccines. There are some that are still waiting to see what's going on. And so we very much are saying to those people that the time for waiting is over. We really do need, as we are going forward into this fall, looking at the increase in cases related to Delta, now's the time to get your first or second dose of vaccine and get those rates up. And then there are some for whom they are very busy taking care of many of the essential parts of life, whether it's looking after their children, working a couple of jobs in order to have money and keep a roof over their heads. And so we're trying to make it as simple as it possibly can be for those that are struggling to find the time or place in their lives to get vaccinated, to make sure they have an opportunity to do that.
Great. Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Great. Thank you very much. And thank you to our media partners for their ongoing effort to join with us every week and share information in the broader community. And of course, to Bill Custers and the entire team at Cable 14 and Clear Cable for helping us put these 100+ media advisories together. And hopefully at some point we won't need to do these anymore. But in the meantime, I think it's been very, very helpful to get this information out there as soon as we have it and as much as is available at this point. Thanks again to Chair Danko of the Hamilton-Wentworth District School Board and Pat Daly of the Hamilton Catholic Wentworth District School Board, and for your ongoing work. And we'll continue the partnership to try and keep everyone in our community safe. And again, there are financial supports out there. You want to visit our website at hamilton.ca/coronavirus to get information around all of those financial supports. And of course, getting your vaccine, you can go to hamilton.ca/getyourvaccine for any information around where vaccines are available right now, which is not limited to city-run mobile clinics or max vaccination sites, but also at pharmacies and other clinics, some in partnership with the Tiger Cats as of today and others. So there's lots of opportunity to get your vaccine going forward. So please get out there, get your vaccine. It's the best way that we're going to be able to protect against this virus, and to maintain your public health measures like masking and physical distancing is still going to be important until we find ourselves past this fourth wave and into the 90%+ category in terms of vaccinations. So thanks everyone for your participation today. Thanks for joining us, and we will see you next time, which is a couple of weeks from now. Thank you.